Hi, good afternoon, everybody. It's really wonderful to be here in person, to see all of you that are here for this event here as we continue our celebration of Martin Luther King Jr. and his legacy of nonviolence, courage, and determination in the face of oppression, ignorance, and violence, and his advocacy for human and civil rights for all. Penn Nursing's mission certainly aligns with Dr. King's vision in our goal to work toward achieving health equity through research, practice, education, and advocacy. Today's event is part of the Independence Foundation Penn Nursing Conversations with Nurse Leaders that was supported by the Independence Foundation. And again, it seeks to provide our nursing students with access to fabulous leaders like our speaker here. Sue Sherman, the president and CEO of the Independence Foundation, is not able to join us today, but I want to shout out and give her a thanks for making this possible. And in particular, want to thank her for her leadership in addressing all the work that she does in the foundation that she leads as a nurse in addressing social determinants of health in Philadelphia. Her foundation, the Independence Foundation, supports legal system, food insecurity, education, and the arts. And I think we've all been touched by many ways by the work and the contributions of the foundation. So I'm going to tell you it is my personal pleasure to introduce you to someone I have long admired from afar, Dr. Roxana Chicas, who is an assistant professor in the Neil Hodgson Woodruff School of Nursing at Emory University. She earned her BSN as well as her PhD there, and she did a one-year postdoctoral training in the renal division of the School of Medicine at Emory. She is well known for her work to improve health for immigrant farm workers, and her doctoral research focused on reducing serious kidney and brain damage that farm and construction workers can experience when exposed to extreme heat. Her work to find solutions to address the effects of heat brought on by climate change are both innovative, practical, and timely, solutions that only a nurse could think of. So it is a personal area for her, as her main goal is to improve the working conditions of agricultural workers. As a young girl, Dr. Chicas and her mother fled the violent civil war in El Salvador in 1986, and both of her parents were farm workers in El Salvador. She lived as an undocumented immigrant in the U.S. for 14 years before acquiring temporary protected status. That in itself is a journey. Dr. Chicas has been a guest on Amplify Nursing, the Penn Nursing podcast. She was a doctoral student when Dr. Marion Leary and Angela Rosa Di Donato interviewed her, and she herself is host of the Nurses Nation podcast. Relating to her work for advocating for immigrant farm workers, Dr. Chicas has collaborated for the Center for American Progress and the Alliance for Nurses, the Health Environment to advocate for climate change policy solutions. As nurses, we do have a responsibility for preventing and mitigating the effects of climate change in health, especially on vulnerable populations like farm workers. And I can think of no better person who demonstrates her research, practice, advocacy to provide exemplars of the transformative power of nursing. Dr. Chicas, welcome to Penn Nursing.
Well, thank you. I'd first like to thank everyone who is here to come have a conversation with me about farm workers, and I'd like to thank the Independence Foundation for supporting this effort and Dean Villarruel for inviting me, and the staff behind the scenes who has worked really hard to make my visit here an amazing experience. Thank you so much. And so I will go ahead and start, and we're going to talk about social and climate injustice, examining the effects on the health of farm workers. This is the MLK series, and Dr. Martin Luther King, was known as a civil rights activist, but what we talk a little bit less about is that he was first a labor rights activist. And during the same time on the West Coast, we had another labor activist that was working against poverty and injustice for farm workers, Cesar Chavez. And they both used the same strategy, nonviolence protests, to bring awareness of the injustices happening. And here, Dr. King sends a telegram to Cesar Chavez, who is fasting as his form of nonviolence protest. So I thought that was just really wonderful how these two great leaders at one point, were working really for the same issue, same cause. Now, pivoting a little bit, we know that climate change is impacting some of the most vulnerable populations. And who are they? Well, communities of color, immigrant communities, communities that have low English proficiency, and low-income communities. These four characteristics. Well, farm workers have those four characteristics. There are 3 million farm workers in the United States. About 70 to 80% of them are Hispanic Latino. The majority of them are immigrants. In fact, it's estimated that between 50 to 70% of farm workers are undocumented workers. So everyone in this country benefits from the work of undocumented folks. They have low English proficiency. Only about 30% of them report that they speak English well. And the average salary of a farm worker is about $25,000 a year. And then on top of that, they work outdoors. They're exposed to heat constantly, day in, day out. They are at the forefront of the climate crisis. So I'd like to tell you a story of a 28-year-old farm worker who came to the United States on an H-2A visa, which is a program that growers can apply to and say, we can't find any workers here in the United States to come work in the fields. So we need to bring workers from outside of the country under the H-2A visa, which has federal oversight. We don't know his name. This farm worker here, his name is Efrain Lopez Garcias. He's a 29-year-old farm worker who had been working in Florida for 9 years. He was undocumented, both working in Florida, and both died from heat stroke. They died from heat stroke, and that is a preventable death that should have never happened. The first farm worker died on his first day on the job, January 1st of 2023 in Florida. It was 81 degrees that day. Efrain died on July 6th, the hottest day recorded in Florida and also the hottest month recorded in Florida. It was 106 degrees. And they died. And this is terrible. From a research perspective, because I have to bring that in, is that I don't think we understand acclimatization very well. Because you would think that someone who's been working in the fields for 9 years should be fully acclimated to working in the heat, and yet he died from heat stroke. The farm worker who died on January 1st, you would think that if he's under a program with federal oversight, he should be protected and not have died from heat stroke. And they're not alone. There are many other farm workers who have died from heat stroke while working all over the country, in California, Arizona, North Carolina, the Great Plains. And in fact, farm workers are 35 times more likely to have a heat-related death. And so I want to talk a little bit about this worker here. He is a fernery worker. So fern is that green leaf you see that many of you have probably seen in flower bouquets. That is what he picks. And each one of those things that he has in his hands, they call them bunches of fern. There's about 12 of those leaves in there. He's paid 38 cents for each one of those bunches. And he works really, really fast and really hard because he's paid by the piece rate, so time is money. So he can't take breaks because he needs to do as many bunches as he can to try to make a little bit more money, because every little bit counts. But that's not the only reason why he's working so fast. The other reason is that as soon as you cut that fern, it needs to get into a cooling warehouse within 3 hours, or it starts to wither away. And if it withers away, they don't get paid for it because it's too ugly and it's ruined. So those are the things that are pushing these farm workers to work really, really fast. And interesting, I just found out that Pennsylvania is the mushroom capital of the world. But something else is that also Pennsylvania is the state that produces the most amount of flowers. And so that fern, coming from the fern capital of the world, will eventually meet with the flowers that are produced here and that we all get for perhaps Valentine's, Mother's Day, and all these special occasions, and gives you smiles. So remember, when you see that, farm workers are the ones picking those. So we know about heat-related deaths. We know that heat causes that. But what about, heat-related illness? When a person doesn't die, what's happening? Well, we know that we had survey studies of workers who would tell us that they were suffering heat-related illness symptoms. So very much like you probably feel when you have a fever, nausea, vomiting, muscle aches, cramps. Well, in North Carolina, there was a study done of 300 farm workers, and they found that 40% of them reported experiencing heat-related illness symptoms. In Georgia, 33% reported feeling heat-related illness symptoms. In California, they did a study using sensors that farm workers would swallow, and that would track their core body temperature. And they found that 8.3 of about 500 farm workers had a core body temperature that exceeded 38.5 degrees Celsius, which is 101.3 Fahrenheit. We did a study in Florida, about 260 workers, and we found that 49% of them had a core body temperature that exceeded 38 degrees Celsius, and 10% 38.5. So why the difference in core body temperatures? Well, 38.5, the NIOSH, National Institute of Occupational Safety and Health, and other occupational societies say, if you are fully acclimatized, you have a medical checkup, and there's medical supervision, you can go up to 38.5. So I just told you, right, that I don't think we understand acclimatization very well. 2, many farm workers don't have access to health care. So they haven't had any type of screening to see if they're okay, what their health status is. And there's certainly not any medical provider on the field supervising them. So we chose the 38 degrees Celsius, which is the other threshold that NIOSH recommends. And as you all know, once you get to 38, you have a fever, right? And so what this means is that workers are basically working with a fever, except they have no infection. So I'd like to show you a quick video of our studies.
The projection that has Florida in the world is that it is Mickey Mouse, it is Miami Beach, it's all these beautiful people, but nobody sees the inside of Florida. Florida is the second largest producer of fruits and vegetables in the United States. And all that work, all that production and fruits and vegetables is being done by people from Central America and Mexico.
Hay que estar todo el tiempo agachado y es muy pesado también cargar un bote de 13 galones y con el peso del sol y se da cuenta.
The Here Solis study is a study that we've been doing in Florida for the last 4 years. So we want to find out, how does working in the fields, being exposed to heat, how does that really affect a worker physiologically? And with these workers, we want to see, will they take a core temperature pill? And that will let us know what their temperature is throughout the whole workday. Will they wear equipment to show us their activity? Will they wear a heart rate monitor, like the ones that runners and athletes often wear? And will they come and see us and let us have their blood and urine samples so that we can really get a whole physiologic profile of what's going on in their bodies while they're at work? Because once we have that starting point, then we can know, well, what's their current state? And then where do we need to go to make sure that over time we're all adapting to heat and making sure that we keep our workers as healthy as possible.
Y es un estudio en el que estamos midiendo el efecto del calor en los trabajadores agrícolas, pero todos empiezan.
Most people in the United States don't know where their food comes from. They have no appreciation. It just drops into the grocery store and there it is. And I think that's what struck me, having done a lot of occupational health research, the fact that we could have this invisible workforce.
A lot of people don't realize that most vegetables, at least part of the whole crop, are hand-picked. Citrus is hand-picked. You know, strawberries are hand-picked. And they got to do it by the bucket, not the hour. So you'll see them in the fields running back and forth, physically, literally with a 40-pound bucket, running to the truck because they get paid by the bucket. All day long, in the heat, in the rain, in the mosquitoes, it doesn't matter what it is, but they do it by hand. There's a large section of the population here in the States that will not do that job for any amount of money. Name the price and you won't do it. You do one day and you would quit. We need them. We need, it's tough out there.
Mi nombre es Jesús, vengo del estado de Tabasco, México. Llegué hace 17 años. Las personas que venimos, como ella, yo, los vecinos, X personas, vienen aquí a trabajar. Desde hace 2 años y medio aproximadamente, estábamos trabajando en una nursery. Realmente lo duro ahí, el calor agobiante que hay aquí. A veces la temperatura ambiente está favorable porque corre la brisa, nuestros cuerpos se refrescan un poco más, pero las condiciones de trabajo son verdaderamente, en el campo son verdaderamente duras.
Mire, me estoy tomando mi tiempo para poder platicar con usted.
They come before work and they have a blood test done and a urinalysis done, and we also put equipment on them that measures their core body temperature and their physical activity and how hot the temperature is around them. And once they're done working, they come back to the office, and again we do a urinalysis, blood test.
Nos vemos.
I just wanted to show you a video so you can kind of see what field-based research is. We really are in the field, and our community partner, the Farm Workers Association of Florida, really
Over 75%
is why we are able to do this work, because they are the ones that are able to recruit workers and have the trust of the community. So now, with that research, the Girasole study, we were able to identify some risk factors for agricultural workers reaching 38 degrees. One of them was high BMI. So I think there's this false notion that people think that agricultural workers are fit because they have such intense jobs, physically demanding jobs. But in our studies, about 70% of them are either overweight or obese. Moderate to vigorous activity. They are working really, really hard, which I find to be a very interesting question. Why is it that these workers, they're blowing the 150-minute recommendation of exercise in just like a day? But why is it that they're still overweight? I would love to research that one day. There's some theories out there. And environmental heat index, so how hot it is. And here you can see that the first time they start reaching 38 degrees is like right after 8 o'clock. Now, I don't know about you, but I'm having my first cup of coffee around 8 o'clock. And we have workers here who are exceeding 38 degrees. Already their body is going into heat exhaustion. We also looked at their hydration and kidney function. And what we found was that 33% of workers developed acute kidney injury just over the course of one workday. So we would take blood in the morning and then at the end of their shift. And we looked at creatinine. And if AKI is when your creatinine increases 0.03 or more, 33% of them are having acute kidney injury. They don't even realize it. And the odds of acute kidney injury increased 47% for each 5-degree increase in heat index. So there's this relationship with working in the heat. These are workers that are at the front lines of the climate crisis. And this needs to be studied because what's happening to them should not be happening to them, because this is preventable. We should also study them because that will give us insight into the general population if we keep heading on this trajectory of getting hotter and hotter and hotter. So the acute kidney injury, that was a cross-sectional study, just a snapshot. We became interested in like, what is happening long term? Are they having multiple episodes of acute kidney injury? Is it progressing? So we did a longitudinal study where we followed workers. We started in January of 2020 and ended in August of 2022. And the nursery workers and fernery workers, those are the two groups that we had. The nursery workers are paid by the hour. Fernery workers are paid by the piece rate. Look at the fernery workers. By the end of the study, 43% of them had acute kidney injury. When we started in January of 2020, it was 21% of them. So we see this increase in acute kidney injury happening to these workers. And the nursery workers, they pretty much stayed the same, around 10, 11%. And that, begs the question, like, should piece rate work be reformed? Because the way that it is kind of promoted to workers is piece rate is good because you have agency over your time. You can start whenever you want, end whenever you want, take breaks, however many breaks you want, whenever you want. But what it does is really incentivize and push workers to work harder, to push themselves. And I think that's why these workers are having a higher proportion of them developing acute kidney injury. And what is the implication long term? We know that once you have acute kidney injury, you are at an increased risk of developing chronic kidney disease. Will these workers develop that? We're not sure. But we do know that in Central America and other places around the world, agricultural workers are dying from chronic kidney disease of unknown etiology. And there are many hypotheses. Some think it's related to heat, others think it's related to pesticides, heavy metals, leptospirosis. It's probably a combination of several things, but I think heat has a major role to play, and the working really hard, because most of the workers we're seeing in Central America who are dying from CKDU are piece rate workers. They're sugar cane workers who are paid by how much cane they cut. So I want to talk a little bit about the vulnerability of workers of color, or invulnerability. And we can trace this back to when we enslaved people and brought them here to the United States and had them working in the fields. And it was said back then that they were built to work outdoors. That's what they were created for. And they thrive working outdoors in the heat. Well, when slavery ended, we got a new wave of people of color who came to work here in the United States. And they came from Japan, the Philippines, and China. It was then said again. These workers, they were just created to work outdoors. They know how to work outdoors. They thrive outdoors. And then we got tired of them, and we wanted to, deport them all. And we got a new wave. Many immigrants who came from Mexico, primarily in a program called the Braceros program, to come to the United States and work in the field. And again, people from Mexico, it's hot over there. They're so used to that tropical environment. They do so well out here working in the heat. They're great. And in fact, that is false. No one was created to work in the heat. But something we talk less about is the Oki migrant farm workers. And these farm workers were from the Midwest. And during the Great Depressions, there was the Dust Bowl, and they lost all of their crops and all of the fields, and there was no work. And what did they do? They did what many of the agricultures we know do. They migrated. They migrated west to California because there were jobs there. And they were hungry, and they wanted to feed their families. And they went to California, and the growers in California were really upset because, oh my God, these are Americans. They are going to want labor protections. They're going to be so demanding. And you know what? They were easily as exploitable as the other farm workers. Because when you are poor and you want to feed your family, you'll do just about anything. And so they created this makeshift tents. They lived on the side of the fields. And the growers were so ugly to them because they would say, you know, at least the Mexicans, they go back to Mexico. These are just staying here. So this, you know, really this historical thought of, you know, always looking down upon agricultural workers as if they are less than human. And why that is? Well, why is it that so many of these workers can be easily exploited? Well, the reason for that is a concept called agricultural exceptionalism. And that is the historical exclusion of agricultural workers in federal and state laws. And I'll give you some examples. The Fair Labor Standards Act, which is the act that basically said workers should be paid at least minimum wage. And the National Labor Relations Act that allows workers to form unions. Well, FDR really wanted to pass these because he really wanted to protect workers. And he needed Southern Democrats to vote yes on this act. So he went to them and was like, you know, we need to talk about this. And Southern Democrats said, okay, we'll vote for this, but you got to exclude farm workers and domestic workers. Why did they want to exclude them? Because they wanted to keep the plantation lifestyle. Of course, they didn't say it that way. They said, these are small family farms. We don't need government regulations to burden them. There's no need. And that is how agricultural exceptionalism started to go into the law and excluding them. We also have the OSHA Act of 1970 that was signed into law by Richard Nixon. And the OSHA Act was created to protect workers from hazardous conditions. And at that time, everybody was focused on chemicals, chemicals, chemicals. We were spraying chemicals everywhere. People were working in factories and a lot of hazardous conditions. Heat at that time was not seen as a hazardous condition, something that could potentially be of a negative consequences to workers. But throughout time, OSHA knows that heat is a hazard. OSHA knows that farm workers are dying 35 times the risk, followed by construction workers, or 14 times. And they have not instituted federal heat protection standards. That was back in 1970, more than 50 years ago. And they still haven't done it because there are powerful lobbyists who say, this is not needed because growers are already protecting their workers. We don't need more regulations in place. Well, if they're already protecting their workers, why are farm workers dying from heat stroke? Why? Actually, this picture here, I like to tell you, I took this picture when I was in my PhD program. And I'm asked, these are fernery workers. They're on their lunch break. I'm asked, you know, why do they wear trash bags? And the reason is that they're not giving any type of personal protective equipment, so they put these trash bags on them so that then when they're going inside the rows of the fern, they protect themselves because it's wet, and they protect themselves from all the chemicals that are used. Then I'm asked, you know, why do they wear hoodies and jeans? That's not good when you're working out in the heat. It doesn't let you breathe. Well, same reason. They're not giving any type of uniform, personal protective equipment, so they wear this thick clothing because, one, they want to protect their skin from all the chemicals, They want to protect their skin from sunburn, all the bugs that are in the field. And a lot of this clothing is donated. So this is what they have to wear. So what can we do? What can we do? You know, knowing that there are these structural barriers in places, I was really interested in knowing, like, what can we do to protect workers? And so with the Farm Workers Association of Florida, we started thinking about what interventions we could do. We looked at the literature. In the United States, there wasn't a single intervention aside from education interventions. Internationally, there were about 12, I think, studies that had been done. And so we thought about, like, what would be good, and the Farm Workers Association said, you know, one of the things has to be, it can't interfere with their work, especially the piece rate workers. And plus, they're moving around a lot, so it can't be uncomfortable. So we came up with a cooling bandana and a cooling vest. The cooling bandana costs $5, and we told the workers is, you wet it, you wring it out, and you put it around your neck. And you can do that as often as you'd like throughout the day. The vest is $200, and it weighs about 5 pounds. And it has these inserts that are made from this material that they melt at a slower pace. And so we gave them 2 inserts, so when one melted, they could put on the next inserts in. And here are our results. And what we found, which I was really surprised, was that the bandana had the lowest proportion of workers go over 38 degrees. And when they did, they spent less time over 38 degrees. And the workers really loved the bandana. They would come back in wearing it. And they said, oh, it was so refreshing. It did keep us cool. A $5 simple bandana. Quite innovative, right? You don't have to be high-tech to be innovative. And the vest didn't do as well. So I think that the reason the vest didn't work as well is because, and the workers told us this too, the vest would work well if we only used it during rest breaks. But we don't really have rest breaks. And the other reason I think is the vest goes over their clothing, so they have a layer there. Another reason is many of them, like I said, are overweight, so there's extra tissue there. And the workers told us, you know, once the vest starts to melt, it starts weighing on us. Where the bandana doesn't weigh much, and it goes right around your blood vessels, right? So we have all these large blood vessels here, and it helps them cool down. The one thing you want to do is make sure that your brain doesn't get too hot, that you're not cooking from the inside. And it appears that the bandana has some potential to do that. So this is a small pilot study. I'm hoping one day I can do a large study. Another pilot study that we did was a hydration intervention. So we wanted to see, can we protect workers from developing acute kidney injury? Very little in the literature about it. There's a study done in Guatemala with researchers used electrolytes, and the workers did not develop acute kidney injury. And there was another study, a survey study, where workers who reported using electrolytes had lower risk of kidney dysfunction. So we thought, you know, let's do it here. So what we did was that longitudinal study I showed you, we took a few of the workers from there and enrolled them to do this intervention. So we randomized workers to either 5 liters of plain water or 5 liters of water with electrolytes. And it was supposed to be blinded, but the group in the electrolyte, they knew that they had the electrolytes because it was salty. And the group that had the plain water, they were kind of like, we don't know, we might have electrolytes, and so this electrolyte solution is what the World Health Organization, it's their formula that they use in countries where there's a lot of diarrhea going on to hydrate people. And what I like about it is that its glucose content is really low compared to those commercial sports drinks that are out there. And so here are the results. So we have the control group, which was their first day, the observational day, where we didn't give them anything. And one thing, off the bat, what we were able to do is increase how much fluids they were drinking. So if you look at the water group, They were drinking 80 ounces on the intervention day. They went up to 134 ounces. And for the electrolyte group, 62 ounces on the control day, and then 119 on the intervention day. Acute kidney injury? No one. No one got acute kidney injury just from a simple electrolyte solution. Quite innovative, you see. Not high tech, but very much innovative and stuff that us nurses can think about. You know, there are some simple solutions out there that we just need to show the evidence and try to get industry, policymakers, people in leadership to adopt them, as compared to the other groups who had acute kidney injury. Now, again, this is a small pilot. It's not statistically significant, but I think it's giving us signals that we need to look further into this, and that there are possibilities to prevent workers from having heat-related illness, renal dysfunction, and that it's all preventable. So what are we doing with these results, right? Because I think dissemination of our research findings is very, very important. One thing we're doing is we are right now in the process of creating a clinician web module to teach clinicians on how to assess, populations who may be at high risk for heat-related illness. And we are partnering with the Migrant Clinician Network to distribute these modules and give CEU credits to clinicians who take these modules. And it's based a lot on our findings and some of the educational material that the Migrant Clinician Network has developed already, but it's not in module form. We're also creating a web module for growers, because I think growers need to know about these studies. And if you haven't caught on, we do not work with growers. All of our research is done in secrecy. Growers don't know that their workers are engaged in research because we go through the Farm Workers Association of Florida. And that should tell you that workers, they want solutions. They care about this. And I think that we need to show growers that this notion that if you work outdoors, working in the fields, it's just hard. It's harsh. It is what it is. We can't do anything about it. But I think there are solutions, and if we can just get some grower to work with us and be creative with us, I think we could protect workers. And I'm hoping that one day I will develop that relationship with a grower. We've also helped the Farm Workers Association of Florida disseminate the findings back to the agricultural community and other communities that are like construction workers that they have access to, on teaching them about heat-related illness symptoms and how to recognize it and potential solutions that they could try. Because it's also important that when you do research with communities, you give them back their research. Nothing about them without them. You have to give back to the community the research. And something that we do, and this came from the community, so they asked us that if you're going to do research with us, we want to know about our health status. And so in our studies, we implement screenings for A1C, for glucose, cholesterol, blood pressure. I talk to them about their kidney function, electrolytes, and I give those results back to them at the end of the workday in Spanish without any rush like you have in a provider's office. And we can just talk. And we asked them once, what is the reason that you participated? What motivated you to participate in our study? The longitudinal study, because they kept coming back and back and back. And they said, we wanted to know our health status. We wanted to know how our sugar is doing. So what else are we doing? Well, our findings are being used by Public Citizen along with other researchers who research this topic to push for regulation. So they have gone to OSHA and they're asking OSHA and demanding OSHA to pass federal heat protection standards. They're also going to Congress and advocating for a law for heat protections for workers who work outdoors. Because again, heat-related deaths are preventable. It is time that we protect workers. We benefit from workers 3 times a day, and it's time that we start honoring what they do and they have protections very much like we have. And so it's an election year, and I hope that each one of you who has the power to vote goes out and votes for candidates who are sensitive to the plight of farm workers. And if you can't vote, that you go still out and advocate for candidates who are sensitive to the plight of farm workers, and that you learn how climate change is affecting your population so that you can be a better nurse. And, you know, social justice is climate justice. And that is my presentation. Thank you.
So thanks, Dr. Roxana. I'm wondering if you could join me
Yes.
here, because I think we'd love to engage in a further Q&A and discussion about some of your fabulous work.
Thank you.
I think I shared with you, and I don't know if many of you know, that my first job as a nurse was working in a migrant clinic. And later years, I worked with, I was on a state of Michigan commission on ag labor that worked with farm workers and also worked with growers. And so I was interested in your comments about growers, because my experience in this committee was that there really was alignment between people on the committee trying to figure out what sort of government support could be given to the farmers that would support the health of farm workers. Discounts for, or subsidies for housing, subsidies for putting in potable water. And I'm just wondering, again, as we're talking about social justice, where do you see some of the levers that might be able to be pushed? I know you mentioned OSHA, but also thinking about growers and workers, what might be done?
Yeah, I've been thinking a lot about this, and something that I thought that might be able to make a difference is, you know, perhaps engaging with workers' comp insurance carriers and developing perhaps something where if growers, you know, engage in some education, and also their workers on heat-related illness symptoms, that implement these kind of interventions, that perhaps they could get a discount on their workers' comp. That's one thing I've thought about. Not exactly sure how to do it, but that's one thought. I've also thought about something we want to do is engage with extension workers. There's extension workers like all over the country, and they work very closely with growers. I mean, what growers, in my experience, what they're really interested in is like, oh, if they have like some type of infection on their plant or something is growing, the extension workers grow and kind of help them out. But not really heat-related illness symptoms. And so we want to train a few extension workers, because they have the ear of the growers, so that they can start incorporating some of our findings and, you know, getting them to think about interventions that, you know, there are solutions out there. Growers really, from my experience, especially in Florida, they're not very receptive to us researchers, outsiders. And so we're working on that. You know, the other thing is there have been efforts to pass local ordinance for water rush shade.
For what? I'm sorry, water?
Water rush shade, for heat protection standards at the local level ordinance. And I don't know if you all saw in the news, but in Texas, there were several ordinances, and there's a patchwork of ordinance. And, you know, a lot of, not just growers, but construction companies and industry who work outdoors went to the governor, Abbott, and said, you know, like, it's too hard for us. We don't know, like, what we need to implement, because it's different by, you know, county, and, you know, it's really hard on us. And what did Governor Abbott do? Well, he just said, you know what? You guys cannot pass any heat protection ordinance at the local level, so we're just statewide. No one is allowed to pass heat protections. And so that was a strategy that, you know, a lot of community-based organizations were doing to let's get local communities, because, you know, a lot of these policymakers say, let local communities decide. And then when local communities decide, they're like, no, 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 no. Not that. Don't decide that. And they come in and put in something in place to block that. And in Florida, I showed you 2 deaths that happened last year. And organizations over there are trying to push for heat protection standards at the local level. And already in Florida legislation, the state government is talking about introducing a bill that will stop any type of local ordinances from happening. So it's a hard fight, but we're in it. And eventually, I believe that we'll get some protections for workers. I'm not sure if that answered your question.
Yeah, I think that's helpful. And I was going to talk about I was wondering about the Texas ordinances as well. And again, I think what you do is provide data to say this is how this affects the health workers. Because I think sometimes people are caught in is we need this work, but if they see as workers as expendable and saying, oh, we have lots more, we'll just move those aside, then the incentive to protect those workers is not very high. Let me ask you another question, since you're talking about coastal and you brought up Cesar Chavez. What's success on the West Coast in terms of unionizing? Haven't heard so much in Florida or on that coast about unionizing. So tell me what that's about.
So California at the state level allows for unions to happen, and that's why California has a union for farm workers. The other states, they don't allow it. Farm workers cannot unionize. So I just find it so kind of appalling that farm workers are not allowed to unionize. So community organizations have popped up to advocate for them, but growers, they have powerful lobbyists. They spend like $300 million a year to lobby. It's really hard for a community organization to fight a machine like that. But I think that with raising awareness of the issue, hopefully more of the general public will become aware of this issue. And this is one of the reasons why anytime I'm asked to do a media interview, I say yes, because then I can take these stories out so people can learn about them, know that like right in your backyard, there are people picking food and they're dying. And maybe consumers will rally together and start demanding protections for agricultural workers.
Great. Let's see what questions you might have from the audience.
Thank you for that really amazing presentation. I was really curious about your relationship with growers until you said, like, you don't really have always seen this work, because I can imagine serious blowback for this research. And the question I have is actually, I think there's obviously so many really important strategies to protect farm workers, but for those of us really thinking about like our own consumption and like where our food comes from, do you have any thoughts or recommendations about, you know, how we think about the food that we buy, the produce we buy, like how we can maybe, it might not feel very big, but like how we can
You know, people often ask us, you know, what can we do? And it's like, you know, do one thing, whatever that one thing is for you. So organic food, we have seen that workers who work like in organic fields seem to have better working conditions, probably because that grower, you know, may be more sensitive to wellness, and that's why they have chosen to go the organic route. That's one way, although that sometimes is more expensive, right? And it's really hard because we live within this system, right, where we also have to, you know, budget our money. But if you can, organic food, if you buy from your local farmers, they usually have better working conditions as well. Vote is really important, very important. And also for nurses, I think it's really important for you all to assess your patients. What is their occupation? What are the risks that are involved with that person's occupation? If they work outdoors, you know now one of the risks. We spend a lot of time at work, and I think occupation is very important. And I'll tell you a quick story. There was this woman who, she was an older lady, and she was working out in her yard, and she got heat stroke and was taken to the hospital. And she was fine, and they discharged her like a day later. And she went home, and she went back to working outside in her garden and had heat stroke again. And no one educated her on how to prevent heat stroke, what she should do when she's working outdoor, that maybe she shouldn't go when it's like the peak of the sun, that it's hot, drinking water, things like that. No one gave her that education. And I think that's something that we need to start implementing in our practice.
Yeah, Nan.
And with regard to the Dean's point on the data that growers may be seeking on perhaps that providing these very inexpensive, low-hanging fruit in terms of interventions to the workers may result in workers that are less likely to fall ill and are healthier overall. Are you gathering that data to provide to the growers, or is there a way to think about what they're looking for in terms of value propositions that could then resonate with the growers? So it's objective data,
Yeah.
not necessarily advocacy, that would maybe stick with them.
So, like I mentioned, we're going to disseminate our findings through the Southeastern Agricultural Center, who has really good relationships with growers. But I think one of the next steps really would be to work with a grower who would allow us to be in the field, and so that we can also measure production, because that's what they really care about, that it doesn't negatively impact their bottom line and their production. And there was a study done in El Salvador where they were working with a grower, with a mill, and they implemented water rest shade. And the way they did it was they made a portable tent and put wheels on it. So the tent could move down the fields with the workers, and they gave them camelbacks so they could drink water. And they told the workers, you have to take 10-minute breaks every hour. And at first, the growers and the workers were like, that's a lot of breaks. How's that going to affect us? And they were kind of resistant, but they did it. And what they found was that they actually increased the amount of sugar cane that they cut. And the workers felt better. And I think we need more studies like that, but it's kind of hard to do that here in the United States when growers don't really want to work with you. So if any of you know of a grower who's like open to it, call me.
Well, Roxana, I don't know about growers in Florida, but as I mentioned to you, we've had work with the mushroom industry here. And as I mentioned, 2 of our students actually won the President Engagement Prize to work with mushroom growers. And they had great relationships with both the owners and also the workers.
Oh.
So if you want to take a look at heat exposure in the temperatures in the mushroom houses, come on over.
Okay.
Come on over. What other questions? One who's waving widely over there. That's you. Yeah.
Hi, I work for the Climate Center for Energy Policy, and I'm curious because we have a researcher who's affiliated with us, who is at the Social Policy and Practice, he's an economist, and he has measured the effect of heat on workers in California. In fact, the conclusions are very similar. Heat really affects and increase the number of, for example, accidents for workers who outside. But in the utility industry, what really caught the attention of industry was that he was able to measure a cost of how much in terms of productivity these companies were producing and how much they have to pay workers compensation. And when they saw that numbers, I know the utilities in California started to pay attention and implement this measure. I wonder if there is a possibility, and there are numbers also for the industry that would allow to show these lowers and this loss of productivity and how they
Yeah.
can addressing this just for the, for in the productivity sector, but for their business value. But
That I am aware of, I haven't seen any like data like that for agricultural workers, but I agree that we need that type of data. So, you know, I would like to be able to produce that, you know, collaborate with someone so we can get data like that. Which is
Great.
okay.
Other questions?
I thought it was like a really great way of illuminating how many disparities intersect in the field of agriculture. And as you were going through your presentation, I thought about one factor that is also often overlooked at farm workers is that the children of farm workers often work alongside their parents before and after school, if they go to school. And so that kind of makes me think about how there's, even within this population, there's a subgroup of unseen workers who might not even benefit from future things that, you know, that future things that law could bring about for workers who are, you know, on the payroll. And so I was wondering, that makes me just wonder, are there any studies out there that are looking into underage farm workers?
When it comes to heat, I haven't seen any. There are some studies, you know, looking at the relationship of pesticides with children, and but not with heat. But you're right, there are a lot of children who work in the fields, and that's part of the agriculture exceptionalism, where they say in law, like, you know, in agriculture, this is family farms. Workers should be allowed to bring their kids on the farms, and so you have children working in the fields where we will not allow that. They can't even go to work, you know, at a grocery store until they are 16. And in farm labor, they can go work there when they're like 8 years old. It's totally fine and normal. It's to preserve the family.
Roxana, in talking about some of the intersections, I think one of the, you alluded to this, was sort of the intersection of farm workers and immigrant status. I mean, you talked about a group of folk who actually have legal status for coming into the U.S. to work.
Right.
And again, I know that that's just a critical element for the growers as well, because as you said, they need the workforce. Nobody's going to do that particular type of work. But in there, there's also, as we know, a group of people who don't have papers, who have come across the border, who are working side by side. Tell me a little bit about how that affects both dynamics of the work, the dynamics of the community, and again, how people in general look at farm workers.
So it's very interesting. The H-2A workers, we have never been able to do research with them because they are so tightly controlled, because their visa is attached to the grower, and the grower has to provide housing and transportation. So there's always oversight over these growers, and as soon as, you know, they know that there's an organization out there of like know your rights and labor protections, they like really do not allow them to come in. And I'll give you an example. The Farmworkers Association of Florida opened an office in the same housing complex that H-2A workers live at. And the Farmworkers Association was told explicitly, we don't want you talking to our workers about none of these labor rights and none of that. Not heat-related illness training, no. Don't talk to them. And so H-2A workers are very much isolated. We are able to reach H-2A workers in Georgia through a family farm worker project, where we go to South Georgia for 2 weeks and collaborate with the Department of Health there. And the growers allow us to go in to where the workers live and provide health screenings. And that is it. We're not going out into the fields, just health screenings there. And these workers, they're here legally, and they don't have access to health care. They haven't seen, you know, anyone. If they get sick, they just kind of suck it up and don't do anything. There are migrant clinician clinics out there that are, the government gives money specifically for them to take care of farm workers. And it is estimated that these clinics are only able to reach about 15% of the farm worker population. Because they don't really have time to go to the doctor. They don't have time to go seek health care. So so you have these H-2A workers who are very isolated, and then you have the farm workers who are some undocumented or mixed immigration status, and they kind of live over here on this other side, and they don't really mix because the growers who have H-2A workers, they pretty much all of them are H-2A workers. Does that make sense? So,
how does that work in the community, though? I mean, I'm sure you have different visa status in a particular community. So, talking about access, well, you talked about housing, but I think, again, just the environment for either group working in those communities. Because I think they think everybody who speaks Spanish is illegal, for example. So
yeah, no, not everyone that speaks Spanish is undocumented. And, within the community, it just feels like they don't really interact much. The H-2A workers will go out to do, their grocery shopping like on Sunday, and they all go together and leave together, and they may go out to eat at a Hispanic restaurant, but there isn't much interaction. And people kind of just view them as also, they're probably undocumented or farm workers. It's really interesting because in Florida, in rural parts, right, you see it's like Trump country everywhere. And yet, the Farm Workers Association in Pearson, the fern capital of the world, they have been able to work with the local police department, and the local police department accepts the Farm Workers Association membership card as a form of ID in that community. So they leave the farm workers alone. But, but those farm workers over there, those are the bad ones. Those are the ones we need to get rid of. So the dynamics are just really kind of complex, and yeah.
Other questions? Yes.
I worked as a nurse practitioner in the health department in Florida, providing maternal child health, and just adding to the comment that she made about children, I had women that would start prenatal care with me, and the family, they were a family of migrant workers, and she would have to finish her prenatal care in Michigan, because then the crops change, so then they need to move. So it's affecting, and when we look at a time in which we're looking so much about maternal mortality rates, that's kind of another victim of this unfair treatment, where women aren't even able to get stable prenatal care. And they're sometimes also out in the field with their children, helping the husband.
Yes. And, in Florida right now, they passed a law where anyone who seeks health care at a hospital that gets Medicaid funding, they have to ask, what is your immigration status? That is a deterrent. It is causing a chilling effect within the community, because they were already hesitant to go to the hospital because they know it's going to be a humongous bill. But now, they're going to be asking about immigration status. Again, marginalizing more and more of this population that
I didn't know about that in Florida. I know that they had tried to get that bill through in California, and there were people rose up and said, no, that's not the role of the health professional. We don't care about immigration status.
They passed it in Florida.
I'm glad you're in Pennsylvania. Other questions? Nancy?
Roxana, the two gentlemen you told us about in the beginning who died, anybody held responsible? Because I think everything we're talking about, any kind of legislation, improved productivity, it's all about money in this country and in many countries. So unless someone has to pay in one way or another for the crime of mistreatment, I don't think much is going to change. It's not going to happen because we all shop for organic, I don't think.
by OSHA, Occupational Safety and Health Administration. There aren't enough people, OSHA doesn't have the workforce to really go out into the fields and see the safety concerns. And Efrain, we only know about his death because the Farmworkers Association of Florida started calling media. This happened, this happened, this happened. And they brought the attention, and that's when OSHA went to investigate. Otherwise, it was just, cardiac. And that's it.
There are many more.
Yes, we think there's an undercount of how many people are actually dying from heat stroke.
So Roxana, I just have to go back to one comment because I'm trying to think. This is not a Debbie Downer type of presentation. I'm trying to say what can we do? And I know you mentioned voting, which again, voting is the answer to a lot of different things. But when you have all these climate deniers here, what are the types of candidates, or what are the questions we should be asking to ensure that, again, people that we're electing either have attention to this? I mean, what's the frame? You can't say, but you believe in climate change, or yes, do you believe in protection for farm workers? But what are those positions we should be thinking about and looking for?
So you have to kind of change the way you speak when you speak with certain sections of the population. So you may not speak about climate change, but you can speak about it's hot. We can agree on that, right? It's hot. There's heat waves. They can agree with that. They can agree with pollution. No one likes to have pollution in their backyard. So it's kind of changing the vocabulary that we use. I think protecting workers. I think we can all agree that we don't want workers to die, right, in the field. So that's asking candidates, what are your thoughts about all these media stories about workers dying in the field, the people who are picking our food, and see what they say. President Biden has ordered OSHA to start up a rulemaking process to draft heat protection standards. And if you go on to see all the public comments, the growers are so organized with how many comments they're putting in there and why this should not go into place. And I think eventually we'll have heat protection standards, but it's going to take some time. And I think nurses are well positioned to really talk about climate change, or just that it's hot, or these natural disasters that are happening, because it's really going to affect the healthcare workforce. We see how fragile the healthcare workforce is just from COVID, right? And if we keep having these weather-related disasters, we will see more people going into the hospitals and ERs. And we should be paying attention to that, nurses. We're seeing it. And we have to be the ones really saying, we have to change this. Our healthcare system can't deal with it. We don't have enough nurses to deal with it. And this is preventable. And I hope that more of you are inspired to integrate climate change into your practice and your research and your curriculum, because it's an important topic that nurses can lead on.
I think that's a perfect ending and a perfect summary. And again, just thank you. I mean, you have provided us fabulous examples of what we can do as nursing, both in our research and our practice, as well as advocacy, and just really appreciate your being here with us. And I don't know if I'll eat some good vegetables ever again without, that's not, I lived during the grape boycott. So, I mean, that was another social justice action that we did way long time ago in California to help folk unionize. But I want to thank all of you, all of our guests and faculty and staff and students who are here with us today. I hope you're inspired by Dr. Chicas and take some of the messages and her actions that she takes in whatever cause that you're working on moves forward. And I think, again, thanks for leading by example. I would ask you to thank again Dr. Chicas.
Thank you. Thank you.
And I would invite you all to our reception. Thank you.